Welcome to What's Up, Doc, a podcast by Marymount Wellness Centers in Fort Collins, Colorado. Hosted by Dr. John L. Bender, MD and CEO of Marymount Wellness Centers. Our mission at Marymount is to empower your community and yourself to achieve healthcare and wellness aspirations anywhere in life.
Hello, I'm Dr. John Bender.
And I'm Janessa Hanna.
And we're here with another What's Up, Doc podcast. This time I'm speaking to employers and HR managers. So, did you know, Janessa, that health insurance costs are one of the most rising expenses for most businesses these days?
It is, indeed.
It's crazy. Every year, it seems like Blue Cross, Aetna, Cigna, whoever, United Healthcare comes out with the new premiums, and they seem to be growing at double-digit inflation. And it doesn't matter how healthy your workforce is, unless you're a very large company and self-employed, it can be very difficult to offer your staff a healthcare benefit. Marymount now has offered, for our fifth year now, a business class version of what we call direct primary care. Let's take a moment to understand direct primary care. So in direct primary care, you join us like a gym. So basically, there's a monthly membership fee for single people, individuals rather, joining the program. Couples can join, but there'd be two individuals. It's $85 per month, and if they pay you in advance, we charge $900. Why would someone do that? Well, I explained to folks that you have to understand health insurance like we do maybe car insurance. So in yesteryear, everyone had $250 deductibles. You'd meet it by March, and then for the rest of the year, everything was $10. Your mammogram was $10, your baby was $10, your MRI was $10, your medicine was $10. Not so much anymore. We now see deductibles of $3,000, $4,000, $6,000, sometimes $12,000 for a family. And what's the expectation? Is a family seriously going to spend $6,000 per family member to get to free health care? Economists tell us that half of all Americans don't have $6,000 in savings. And so basically, if you hit your deductible every year, you're bankrupting yourself if you're in that 50%. And for the rest of us, that's still a big hit. So what can we do differently? Well, think about car insurance. Do you file a claim every year? I don't. Janessa, maybe you're a bad driver. I don't know. Do you file a claim every year?
Well, no, I don't ever drive Dr. Bender. I work from home.
Oh my goodness. Okay, great answer. But most Americans file a car claim about every 7 years when they're an offender bender, right? And then they budget for their car, right? So they put fuel in their car, they go to the gas station, they change the oil, they change the tires, they wash the car, and they pay for that. They don't file a claim, right? They budget $2,000, $3,000 a year for their car. What we tell people is budget $1,000 for your body, which is more important than your car, really, in the long run. You'll own several cars in a lifetime. You only get one body. And buy us for your health care and buy the insurance to protect your assets. Because it turns out health insurance isn't health access at all. In fact, either one of us right now, Janessa, could call 911. You're in Ohio, I'm in Colorado. An ambulance will show up. They'll take us to the emergency room. We will get our heart cath if we're having a myocardial infarction or heart attack. But then the second heart attack will occur 90 days later when we get the $150,000 bill, right? So that health insurance isn't to give you access to healthcare. You can get access without insurance. What it is to protect your wealth so you don't bankrupt yourself. So really the way to play the game is to buy the cheapest bronze plan on the market, and then again, don't touch your deductible. And so by doing so, you keep your costs low. Now, if you're not touching your deductible, how do you take that risk? Well, this is where direct primary care comes in. So at Marymount, we offer in-house lab, x-ray, mammography. We have great services like extended hours, Monday through Friday, 8 to 8 in our Fort Collins market, Saturdays 9 to 1. In our Parker location, we're open 9 to 5, Monday through Friday. But you still have 24-hour access to us through our telehealth app, the Direct Health app, which is shown here. And you can download that. There's no charge to join and use the app. There is a charge if you have a telehealth service on Christmas Day, but it's going to be nominal, much less expensive than going to an urgent care emergency room. And so now employers can access this great program for a lower cost. Typically an employer, because they're going to bring us, let's say, 5 or 10 or 20 employees, we're able to give them a price discount, and then their employees can be seen by us. We are going to do everything we can to take care of them, offering the same services an urgent care would, for example, casting, splinting, sutures, well visits, annual health care checks, and do everything we can to keep them out of the specialist's office. And in general, if the specialist does it in-house, we try to do it in-house when we can, and we try to send the specialist only those things that have to be done in the hospital. That is our goal. And in doing so, we lower the cost of healthcare dramatically for the employer, who now can purchase a very inexpensive bronze plan and offer this great DPC service. And paradoxically, their employees are oftentimes getting better healthcare than if they had a very expensive plan where the primary care doctor might not be available for days to weeks for a next visit slot.
Right. I have insurance outside of Miramont, and when I go to the doctor, half of my things aren't covered by insurance that I'm paying money for. But when I use my MVP membership, I'm able to get the things that aren't covered by my actual insurance covered by MVP.
It does dovetail nicely. And so employers, if you're interested, please reach out to us at 970-225-5050. Here's a link to the business class website where you can read more. Amanda and Karen and I would love to bring you lunch and chat with some of your employees and tell you about the benefits of the program. Well, that's all the time we have for What's Up, Doc. Again, I'm your host, Dr. John Bender.
And I'm Janessa Hanna.
And we're wishing you a happy day. Take care.